So, thank you, Megan, for being here with us today. I'm really excited to learn a little bit more about the brain gut connection, and I'm sure our audience will be excited for it as well. I want to give you a little time to share about who you are, what you do, and a little more about that brain gut connection we're all excited about.
Sure. Well, thank you so much for having me on. I am a clinical psychologist at the University of Michigan. But I guess what's a little bit unique is that I specialize in gastroenterology, and I've been in this field now for a very long time. And I came to Michigan where it was really my job, along with who's now our division chief, Dr. Bill Che, to create the program. So, a psychologist fully integrated into our GI division. And at the time, and this was about 12 years ago, we were one of very few places in the country that were developing a GI behavioral health program. And so from there, I developed a training program where I've since trained two additional GI psychologists and have them on our faculty as well. And so for being a very large GI division, one of the largest in the country, the three of us serve patients for a variety of GI conditions, ranging from irritable bowel syndrome
Mhm.
to gastroparesis and other motility disorders, as well as inflammatory bowel disease and things like celiac disease. And so we really pride ourselves on being a part of a very holistic and multidisciplinary team for patients. And that is still something that I'm really proud about, is because lots and lots of places around the country are interested in creating these types of programs as well, because patients benefit so much. So I've had the opportunity to be a part of different educational opportunities for psychologists around the country, as well as for gastroenterologists, to learn just
Mhm.
what the value is of having a GI psychologist. And so I've participated with the Rome Foundation. I sit on the board for the Crohn's and Colitis Foundation, and really our other governing GI boards, like the American College of Gastroenterology, as well as the American Gastroenterological Association. So I really have a lot of fun on the education side, but I am still seeing patients nearly every working day, and so I like to be kind of boots on the ground as well as educating elsewhere too. So
That's
that's
amazing.
that's the introduction.
Well, that was quite the introduction. And just again, thank you for taking the time to be here with me to chat today, given how busy you just told us that you are. So we really do appreciate it. But I really love this topic because as somebody who I was diagnosed with gastroparesis back in 2014, and even now, being in this space as long as I've been, being a part of G-PACT and a community and talking to so many people, the idea of like a GI psychologist is so foreign to me. And after we had chatted the first time and, me being me and wanting to look into things a little bit more, and now that more is happening about the brain gut connection, I think back like, man, where was this a couple years ago?
Mhm.
So it's really great that there are people like you who are championing this idea that we need some of this, that there are more aspects than take some Zofran or have Reglan to fix or make the GI symptoms better, that there are holistic approaches that really can make a big difference. And to also, set the facts straight that when someone tells you that there's, brain gut connection in these types of motility disorders, that they're not telling you it's all in your head. So,
Correct.
I would love for you to expand a little bit more on what somebody means when they talk about the brain gut connection and how that can kind of translate into different types of holistic treatment.
Yeah, so I want to take a step back and make sure that I was clear that I don't sit on the board of the ACG and the AGA, but I am on the board of the Crohn's and Colitis Foundation. But my work there, and why I mention it, is because many years ago, psychologists weren't invited to come give talks at national
Mm-hmm.
conferences to help educate gastroenterologists on the benefit of our integrative care. And so it has been really my privilege to receive invitations to give those talks and be a
Mm-hmm.
part of, that circuit of educators. And that's just it is unfortunately patients don't know yet about or some do, but some don't. And
Mm-hmm.
access is an issue. But to go back to your question on the brain gut, you hit the nail on the head when you said this does not mean that your gastroenterologist is saying, like, oh, sorry, this is in your head. Just chill out. You're fine. No, the brain gut connection is a physiological thing. It is the brain and gut are connected along our vagus nerve and our
Mm-hmm.
enteric nervous system. And these are automatic processes that drive communication. So I always say it's a bi-directional superhighway. The
Mm-hmm.
brain is interpreting signals and symptoms that are happening in the digestive tract, and the digestive tract is sending signals back up, and it's the brain's job to then interpret that and decide what to do with that.
Mm-hmm.
And so when we think about brain gut connection in patients that are living with gastrointestinal issues, a lot of times some of that symptomology, so a gurgle, a cramp, a spasm, bloating, sends signals up
Mm-hmm.
along that digestive tract based on the nerves that are in your system that line your intestinal tract. And it's the brain's job to, what we say, downregulate those signals. But a lot of times it doesn't do that. It actually does the opposite and it amplifies those symptoms. And something called visceral hypersensitivity, where your brain is very hyper focused on those sensations that may be benign, meaning that they're not dangerous, but
Mm-hmm.
they are uncomfortable. And so the brain is really focusing on those signals. And that's where we then see um, influences on our motility, on the increasing sensitivity of the gut, and even then the secretions that are happening in our digestive tract. So it's a very real thing. The brain
Mm-hmm.
gut axis is certainly a part of our treatment kind of strategies to address. And I think the cool thing about what we do as psychologists in the GI world is, we're not putting a band aid on that. So,
Yeah.
not to knock medication, there's certainly a place for medication for many of our patients. But sometimes it feels like, well, let's get a little bit deeper at the root here and the actual communication pathways happening between our brain and our gut. And our psychological therapies that we use with patients are called brain gut behavioral therapies.
Mm-hmm.
And they have been shown in research to be very good at getting at that visceral hypersensitivity, at some of the motility changes. And so it gives patients another option to think about with their treatment if they can get access to it.
Yeah, you are speaking my language when you're like, let's get to the root of the problem or a root of the problem, instead of just like you said, there's a time and place for every treatment, but looking at it holistically, we want to treat the person
Uh-huh.
is such an effective process. And as you were talking, I was thinking like, is this why when I'm really stressed out all the time, my gastroparesis flares a little bit? Like, is it when everybody says that stress goes right to your gut, like why you get nervous? And all of a sudden you get butterflies in your stomach. Like those are the things
Mm-hmm.
that I think about now when I am stressed out, my stomach hurts a little bit more, or you're thinking it always goes right to your gut. And to hear somebody so eloquently explain why that happens and really make it just, I don't want to say sound real because it is real, but it just gives you validity and it gives the patient understanding that this is real. This isn't in your head. This isn't just something that you're imagining. All of these pieces start to line up when you actually take a step back and look at what's happening with the patient. And if we treated that a little bit differently and a little better, that maybe some symptoms could improve, which is exactly what it sounds like you're doing with all of your patients and everybody in the clinic.
Yeah, it really becomes helpful to understand some of the actual physiology of this.
Mhm.
That, when you experience stress, we think of it a lot of times as emotional, right? Like
Mhm.
we need to calm down, we need to manage our stress. It's emotionally causing anxiety or it's impacting your sleep. But there's actual physical changes that,
Mhm.
and the butterflies in the stomach or the stomach ache are those physical things that we're very in tune with, urgency, diarrhea that
Mhm.
you're going to the bathroom more regularly. Um, but understanding that that stress can actually, impact the chemicals that are produced in your gut. And as an example, 90 to 95% of our serotonin is actually produced in our gut. And so
That's
when we have
crazy.
these, yeah, we think about that as like a brain chemical,
Mhm.
but that's incorrect. It's the majority is in our gut, and so alterations in the gut are going to impact our mood. And so optimizing again, and I always am very careful about stress management. Like, and
Mhm.
you'll if you I think you found me on Instagram, so
Mhm.
I do say a lot about stress management and the importance of taking time to calm the body and be in tune with this. But, I also want to be very realistic with, we are in a time in our world, honestly, where no one is immune to stress. We're getting it
Yeah.
from all angles. And some of us are going to be more stress sensitive,
Mhm.
meaning that you're going to have more physical symptoms that comes along with that stress. And so it's not as easy as like, just taking a deep breath a couple times a day. It really
Yeah.
is a whole process. And that's what I work on with patients in therapy. And really my content is to kind of draw you in and at least get you curious, but I think to validate that, if you're struggling with this, reach out to a mental health provider. You don't
Mhm.
have to be in therapy for the rest of your life, but if you feel like you're struggling with your stress management, you could probably really benefit from learning some strategies, learning about how to
Absolutely.
optimize over time.
Yeah.
So they aren't quick fixes, but sometimes, they're a good starting spot.
Yeah, absolutely. I know that I as again, as you're like, yeah, like no one's immune to stress. We're all a little stress sensitive. I was like, oh, she's talking right to me, because I've even noticed in the last year and people who maybe haven't dealt with such high levels of stress or maybe even just high reactions to stress in past years are feeling it now and maybe you're having an uptick of symptoms. Like I know in the last few years, I've had more gastroparesis flares and symptoms that I had the year prior. I also know in the last few years, I've been a lot more stressed out. You know,
Mhm.
our correlation does not always equal causation, but at the same time, it's very likely that the two of them are playing a part in the like kerfluffle that is inside my body all the time.
Yes.
And I know that when I am stressed mentally, the first thing, and I've said this for years, not even just as of late, but my gut is the first thing to go. And that's for a
Mhm.
healthy, like we were saying, that's for a healthy person too. That's somebody without motility disorders or severe GI disorders. You get that right in the gut. And,
Mhm.
thinking that serotonin lives in the gut, I'm like, have I been lied to my whole life? Like, I didn't really know that. Or did I just not put two and two together because of how you learn about serotonin and SSRIs and how things work in the body? And I'm like, it all really starts making sense now where you understood it before, but the application now and seeing how I react that when I'm physically not feeling well, it stresses me out. And if I can't find a way to calm down that stress or at least pull it to a manageable level, that increases the physical symptoms, which increases the mental symptoms, and so on and so forth. And that snowball just keeps getting bigger and bigger
That's
and
right.
bigger. And I know you had mentioned some different techniques that you use with some patients, and you had mentioned different relaxation techniques and hypnosis. And I was hoping that maybe you could talk a little bit about that because I thought that was incredibly interesting, since, again, not something you hear about very often as a treatment option.
That's right. If you would have told me when I was in graduate school that I would be doing hypnotherapy with patients on a weekly basis, I probably would have thought you were a little bit nuts. But the type of gut, we call it gut directed hypnotherapy, and it falls under that umbrella of brain gut behavioral therapies. And I will preface what I'm about to say with everything that I'm talking about is science based.
Hmm.
So, gut directed hypnosis has been studied, particularly the research began in the GI space with irritable bowel syndrome or IBS.
Hmm.
So, there's over 40 plus years of research in
Wow.
that area. And we've taken a lot of that literature and the ways in which it works along that brain gut axis. Um, and found it helpful for other GI conditions. So there are protocols out there that are scripted that have been researched for IBS for things that are in the upper GI. So things like something called globus, which
Okay.
is this very uncomfortable feeling like there's a golf ball or something stuck in your throat that you just can't swallow down. And sometimes that can come about with stress
Hmm.
or functional dysphagia, which is a difficulty swallowing. But also, we've applied this for gastroparesis patients and those living with inflammatory bowel disease. And so, even though from an IBS perspective, IBS and gastroparesis are two different things, though there
Hmm.
can be a lot of overlap and very similar symptoms, the way I've used hypnosis, which really works to kind of rewire some of our maladaptive stress responses happening between the brain and the gut. And so, what a session might look like is you are in a very comfortable, relaxed place. If you've ever done guided meditation before, it can feel very similar to this, but what makes it hypnosis is that we're putting someone in what's called a trance state. And we've all experienced this in one way or another. If you've ever driven home from work one day and kind of gotten to your driveway and you're like, wait a minute, I
How
don't
did
even
I get
remember.
here?
How did I get here? That was a trance. So
Interesting.
many people are susceptible to this. Um, so a trance isn't dangerous,
Hmm.
and it's also this is not stage hypnosis. So you're not going to cluck like a chicken. I'm not going to make you do weird things. This is a guided session where we're is safe,
Hmm.
and also using very specific strategy, very spe- very specific suggestions about your digestive functioning. And so, where our scripts kind of focus are on that hypersensitivity that I mentioned earlier, on
Hmm.
regulating motility patterns. So our scripts tend to be helpful whether a patient has diarrhea or constipation, or they're
Okay.
fluctuating back and forth. And then also to kind of quiet some of those uncomfortable sensations like nausea or cramping or spasming, the pathways that kind of guide that along our brain and our gut. Um, so I think what's pretty cool about hypnosis is that even in patients that have been refractory to other treatments, like medication or nutrition, most tend to have a response to the hypnosis. Now, this is true
So
for
cool.
IBS patients, but I guess in my clinical experience and when I'm working with a patient living with gastroparesis, I look at this as yes, the motility of an IBS patient and a gastroparesis patient is slightly different. Some of the structural things are a little bit different,
Hmm.
but it doesn't hurt to have a tool in your toolbox where number one, you're hearing some positive language about your gut. You're
Hmm.
learning how to relax your system. You are able to do this at home in between our sessions, and you're learning this kind of nice body relaxation skill. And
Mm.
so, I think anecdotally, I can speak to in my practice, most patients that have gastroparesis that learn this as a skill will find some benefits, whether it be, gosh, after a flare up of my symptoms and I've been vomiting and I've, not been able to eat very well, or I've been in the bathroom for hours and hours. It's really nice to sit down and do that and like find some calm and peace within my body.
Yeah.
So people enjoy it. And once you get over some of the stigma associated with even just the word hypnosis, you find that you remain in control. The suggestions are very kind of nice to hear.
Mhm.
'Cause most people don't have the best relationship with their digestive system at the time that
Yeah.
they're kind of establishing with me. Um, it's a skill that they can use down the road too.
Yeah, I think as with a lot of mental health therapies that as much as we might not want to like take medication, sometimes it feels easier to say, like, just give me a medication over doing this work, right? Because there's a chance that the medication might give you an immediate reaction, but the other thing requires work, right?
Yeah.
Like, you don't just see you once, you learn how to do this thing, and then boom, like all of a sudden I retrained my GI tract and now my gastroparesis is under control. Like, you know that, I know that that's not how it works, but sometimes when you've had gastroparesis for a long time, and I'm sure that you've had patients in this space too, and you've tried so many different things, you're
Hmm.
so burnt out from just trying things that, like, even though if you could guarantee me 100% that doing this is going to make me feel better, it's going to be hard almost to convince me to wanna do it just because I'm tired of doing things. I
Yeah.
just want to stop having to do things. So, there's so much mental work that goes into even wanting to try something new, especially something that sounds controversial, but when you talk to somebody and really who understands it like yourself and do some research on your own or talk to somebody that's been through it, it's so different from what we're generally offered that it feels like that's not going to work because if that
Yeah.
worked, everybody would have access to it. And we know that that's not the case. And I know that I've been resistant to different things over the years. My mom listening to this, she's probably going to roll her eyes when she hears this episode, but she's talked about like different types of breathing techniques
No,
and
mom. I
all
swear.
all of these different things, and she's like, "You should try this, and these types of breathing and these relaxations," and I'm like, "Mom, I'm tired, I don't want" exactly everything that I just did or just said, I would say, I'm like, "I don't wanna do that, I've tried
Yeah.
that, and I don't wanna do it," because you just get so caught up in that space of, like, I'm just tired of doing.
Yep.
And I I tried all the medicines. I am breathing, when in reality you're sitting like this, everything is so tight, everything is just sucked in like nothing, even in a healthy person, is going to feel comfortable, relaxed, or anything until you pull your shoulders out of your ears. You're able to take a deep breath. You can get your diaphragm out from underneath your rib cage, really learn how to expand your stomach, feel your breathing, and really kind of get in tune with what happens to your body when you're breathing a certain way or when
Yeah.
you're talking to yourself a certain way. Which one of the things I wanted to ask, talking about the relationship with either your digestive tract or maybe with food. I know I didn't have the best relationship with food. Most people who, when food hurts your stomach, you don't really have a good relationship with it after a
That's
while.
right. Yeah.
Um, in some of these therapies, do you work on maybe retraining some of how you view food,
Mhm.
along with how you view like your GI tract? And if you do, what might be a first line of, change or working on that some of our listeners can do at home to maybe not hate food so much when it's not
Yeah.
so nice to us?
Yeah. It's heartbreaking, right? Because we all need food to eat.
Mhm.
We have to fuel our body, and so it's unfortunately very common for people living with GI conditions to restrict food,
Mhm.
to avoid a high number of different things. So really living with a very restrictive diet, and so what I will say is we should ideally be screening for disordered eating in our
Mhm.
patients living with GI conditions. In the last few years, there's been an uptick in research looking at a diagnosis called ARFID, or avoidant restrictive food intake disorder, which is a
Mhm.
type of eating disorder that we're seeing is in high prevalence in our patients with GI conditions, because people are restricting or limiting the types of food that they eat, not because of a body image concern, but because
Mhm.
of this desire to avoid getting sick or
Yeah.
getting GI problems. And so, if somebody has restricted or developed such a difficult relationship with food where now they're living with an eating disorder, I'm going to connect those patients with an eating disorder specialist, because
Ugh.
there can be risks of refeeding syndrome. There can, if there's been a
Sure.
significant body weight reduction, we have to be very mindful of that. And as I was saying, unfortunately, that's not too uncommon in our GI patient population. But let's say somebody has not, reached the point where they have an eating disorder, but they're just anxious about food. They only eat, certain things. Um, Teaching relaxation strategies to calm that nervous system down before eating can be really helpful in terms
Mm.
of calming your digestive tract. So, you know, um, to take a step back, I might also uh, encourage that patient to establish with one of my GI dietitian colleagues, so that you've got a really good idea of foods that are gentle on your stomach, foods that can work for you, how to pace your meals throughout the day. Should you kind of focus on 3 meals a day and 1 or 2 snacks, or would you do better to have smaller, more frequent meals based on what your
Mm.
your diagnosis is? And a dietitian is so critical, I think, to the
Mm.
team. So, if you've worked with a dietitian and we've got a better idea of the foods that work well for you, but there's still anxiety about that because some of those foods might sometimes trigger symptoms, that's where, again, we can work on the fear of symptoms that can create stress before eating, which can worsen your motility.
Mhm.
We can shift from some of that fear based thinking to curiosity around
Mm.
small exposures with some of your food, and tying those exposures with some relaxation interventions to again activate the body's relaxation response. And then after eating, I'll kind of have patients doing maybe diaphragmatic breathing, maybe a
Mhm.
5 to 10 minute guided imagery exercise. I do a lot of tailored and targeted scripts with patients. So in our sessions, we might be talking about, what the thoughts are that are going through their mind with eating, how they feel, and we'll talk about maybe again a 5 to 10 minute script that they can listen to before they eat,
Mhm.
to then kind of go into the meal with more of a relaxed state, and or after a meal. And that's not meant to
Yeah.
be like a forever thing. It's just
Mhm.
meant to kind of help cope with the anxiety, help reestablish a healthy relationship with your eating, to certainly validate why we might have an uncomfortable relationship with food. But my goal is to help you liberalize your diet as much as you can, to regain that healthy relationship with food, and to decrease your food related anxieties.
Yeah, it's interesting. When I went to, I was having some trouble swallowing. I know you mentioned like dysphagia earlier,
Yeah.
and I was having the last few years, but in this year, it got really bad to where I was choking actually.
Mm,
And, I work from home. My husband doesn't. So I'm by myself and I'm like, I don't want to eat anything because I
yeah.
was so afraid of choking. And, it got to a point where I would be struggling to get pills down. I would choke them back up. And as you get nervous, like if there's a motility issue and then you add the nervousness on top of that motility issue, everything that we've been talking about, it was almost a guaranteed choking issue right
Yep.
then and there because I just was like, nope, I'm going to choke on that. I can't do that. Nope, that consistency is not going to work for me. And I ended up seeing doing the swallow eval, and I saw a speech therapist for a few weeks. And she was talking to me. She's like, we'll go over some stretching. And I'm like, stretching? Like, what do you talk? Like, like,
Yeah.
okay, she was great. I'm like, all right, I'll test, I'll try anything. So we go in, and everything that you just said was like what she worked with me, and the diaphragmatic breathing, even sitting a certain way,
Mhm.
doing
Mhm.
something before the meal, in the middle of the meal, after the meal, to kind of, again, like get my shoulders out of my ears, pull everything down. The diaphragmatic breathing and certain like massage techniques actually in the jaw and down in my neck were the most helpful. And I remember sitting in the office with her, and she had me doing something where I'm pulling on my tongue, thinking,
Yep.
this is the weirdest thing ever. But let me tell you, I haven't choked since I implemented what she had me do. It's not perfect. I still cough. I still have some symptoms, but they're manageable symptoms. And not
Yeah.
only did she give me something for an acute stage of, if something has flared up and this is getting worse, try, A, B, and C, along with all the other things that she has me now doing as second nature. I remember there was a breathing and like swallowing technique that she had me do, where it was you breathe, then you swallow, and then you breathe, which sounds like, isn't that what you normally do? But we take for granted
We
that
sure
your
do.
body just does these things until it doesn't work right. And then you have to go through that whole retraining process. And I remember coming home and telling my husband about this, and he's trying it, and he's like, wait, what did you have to do? Like, what's the order? And now I just do it, and I
Yeah.
have a lot less trouble. And initially, I thought it was a little bit weird. I'm like, "How is this gonna help me?" Like, okay, like, I choke, but now I'm just breathing differently, and I'm like, "Oh my gosh, this is so much better." And everything that you're saying and everything that I went through in that aspect, they all are under that very similar umbrella of just really getting in tune with your body, more so than just understanding that something is wrong with your body and maybe being frustrated that it's not working properly. We already know that, right?
Yeah.
And we live in our bodies, we feel them, but it's really hard to relax and take a moment to breathe and not be in that fight or flight mode all the time when you don't feel good. And when you have to eat something and you don't want to, because the last time you ate it, it made you puke your guts out.
Mhm.
No sane human is going to want to go eat that again. Nobody's going to want to eat something with almost a guarantee that that's going to make them sick. For me, there are still foods that I avoid. Absolutely will not touch them again. Like beef, one of them. I haven't had beef in over a decade. I will be hard pressed to ever try it again.
Yep.
It's just, but I have, I'm okay with that. It's not something where I feel like I mean, I do have a disorder around it, but that is something, for me, I look at that, I acknowledge it, and I'm okay with it. But for some people, that restriction, as you alluded to earlier, can become so large that the anxiety is sometimes can be harder to handle than the
Mhm.
actual disease itself, because it just
Mhm.
amplifies the disease. And I've been in that situation, and it's scary, but it's just great to know that there are people acknowledging that. And I hope that as the years go on and hopefully more treatments become available, that there are more practices implementing a lot of the strategies that you've been talking about, because I I feel like the biggest piece, at least that I'm taking away from this as a patient, is that you would like to listen to me, that you would like
Mhm.
to hear me. And just that alone, feeling like you're in a position where somebody is acknowledging that this is not easy and they want to do something to help you, is the best first step to getting the patient to a better place in wherever they are in their diagnostic journey or where they are in their disease progression.
Yeah, I think each individual is an individual.
Mhm.
your experience, your comorbidities, your it's oftentimes, unfortunately, I wish it were a straight path, but
Yeah.
there's a lot of winding, curving, and as you mentioned earlier, that it feels like um, you're exhausted,
Mhm.
and so what I will say, I don't wanna I wanna so hypnosis is one of the tools in our toolbox. There's a lot. We use something called GI specific cognitive behavioral therapy as well, where we're identifying that the thoughts that you have that might
Mhm.
feel very valid, sometimes they're not fact. Our thoughts are not always fact.
Mhm.
And if we don't challenge those thoughts, then they can kind of take over and increase the anxiety, increase the avoidant behaviors of whatever it may be, food, social situations, travel, work.
Yeah.
Um, so we use a combination of things, but I do think that it's really important for your listeners to understand that, especially if you're working with a GI psychologist, our role really is to help you in navigating your GI issue or your health issue. And so if you're suffering with, more moderate to severe anxiety or depression or untreated trauma, active trauma symptoms, untreated eating disorder, um, before you start with a GI psychologist, we want you to establish with a general mental health provider or a mental health
Mhm.
provider who specializes in what your needs are at that moment for more comprehensive work to stabilize those symptoms.
Yeah.
So I want to differentiate a little bit because it's important that, our brain gut behavioral therapies are not as effective if your mood or anxiety or trauma symptoms are in that more moderate to severe range.
Sure.
So that's that going back to exactly what you said of we want to listen to you. We want to hear you and we want to connect you to the right resources that they might not be easy, but
Mhm.
they are so important to your holistic health. I know you want to address the gastroparesis, but we've got to look at the bigger picture of all these other things that are happening in your life and guide you to that right treatment plan.
Yeah, and I think just I've had some really great providers over the years and in different disease states, and I've been with my therapist since way before I was sick, which is good in a lot of ways cuz she knew me before. So she knew
Yeah.
who I was and was with me through all of the diagnoses and has really helped me work through that. And as a person who knows how beneficial therapy can be, that without those tools, as you said, the newer tools, the additional tools might not be effective. It's like building a house with no foundation. The house
Hmm.
can't stand if the foundation isn't there. And it's just great that you know, trying to treat the patient, even if you're like, come back to me, but I want to see you. I want to help you.
Yeah,
Just take this one step first. I'm not leaving you. I'm not saying I don't want to help you.
that's right.
Again, just listening to the patient to help them determine what that next step is. That just, like I said, just feeling heard as a patient who has been unheard so many times,
Hmm.
especially in the GI space. For myself, I've had all the medications, I've had all the treatments, I've been on TPN, I've been on tube feeds, I've had the surgeries. Like, I went recently and I'm like, what do I do now? I'm maxed out on the medications. I'm still not feeling well. These are the symptoms that are happening. This is how it's affecting my daily life. I've already done these things. Those things are too extreme at this point to go back to. Where do I go? I
Hmm.
didn't get an answer. And, it's nothing against my GI. I love her. She's doing the absolute best that she can with the resources that she has because we don't have a U in our area, right? Like we don't have anything like that established in our area. So I would love it as this comes out more, there's more research, people are paying attention to it more, and patients are understanding when they see brain gut connection that it's not a dig at you, because immediately when we've probably all been told that once, like, "Are you sure it's not in your head?" Like, "Yes, I'm sure." You know, it'll
Absolutely.
more more of these more things will happen, and just be able to really treat more people, especially when you feel like you've tried it all and you're like, all right, what you got? Let's give it a try. And really just feel better, because that's all we want. We want everybody to be able to eat, at least eat whatever it is that they can, however that looks for them. You know, living with chronic nausea and vomiting and any sort of motility or GI disorder is difficult when our whole lives are surrounded by food. Every social
Yeah.
event, everything that you do, there's always food involved, and it's difficult and very isolating when you can't participate. So if this is a new or another tool to add to the toolbox, I think a lot of people would be very, very interested in trying.
Yeah.
So, thank you so much for joining me today. This has been wonderful. I love talking to people with all this new cool stuff, because I learned so much, and the way you explained everything was easily understandable, and I really appreciate everything, and I really hope our listeners do as well.
Yeah. Do you mind if I share a couple resources for them?
Oh, we would love resources.
Okay. Because you mentioned, access is important, and there
Hmm.
is a virtual practice of GI psychologists that are licensed in all 50 states.
Oh, wow.
So
Okay.
if you go to gipsychology.com, this is a practice of like real clinicians. So they're not robots, it's not AI.
Real
They
people.
are they're real people, and I consult for their company, and they're just great humans, and they're utilizing brain gut behavioral interventions that are science backed, and they really enjoy working with people that have chronic GI health conditions. So that's a really great resource. And then I will just shamelessly plug my own book. It's called Mind Your Gut: The Science-Based Whole Body Guide to Living Well with IBS. But it's a great book and resource for people with gastroparesis as well. We talk a lot. It's co-written by Kate Scarlatta, who is just an amazing GI dietitian, and so we've had a lot of fun with the book, and it's coming out in Spanish actually, in
Oh,
the next
great.
couple of months as well. And then we also have a podcast called the Gut Health Podcast, where we talk about all things associated with various aspects of gut health. So
Yeah.
lots of content there for people that are interested in this.
Yeah, thank you. And I will make sure to include all of that in the comments too, in case, you don't like writing things down like me, to put all that in for everybody. So, thank you again. It's been great. And your resources were great to share as well. So I will, again, make sure that those are in the comments. But this has just been wonderful. And it's just so enlightening, and so really from a person as a patient and as a patient advocate in this space. It's just really, really nice to hear that there are people really championing, better treatments and better options for us, and really trying to get us all into a healthier and safer, life. So thank you for everything.
Well, thank you for all the work that you're doing with
Hmm.
G-PACT and all that you're doing.
Thank you.